Welcome to this deep dive on PTSD. You guys reached out wanting to better understand PTSD. Maybe you know someone who's struggling. Or maybe you're seeing it in the news a lot lately. Or maybe you're just curious about the impact trauma can have. Either way, we're going beyond those typical headlines today. Our mission, to really get a handle on what PTSD is, what causes it, and importantly, how it can be effectively treated. We're going to be diving deep into a U.S. Department of Veterans Affairs booklet called Understanding PTSD and PTSD Treatment to do just that. And while it's written for veterans, what we're uncovering here is relevant to anyone because trauma doesn't discriminate.
That's a key point right out of the gate. This booklet is a fantastic resource, and I think you'll find it surprisingly relatable, even if you haven't personally experienced combat or served in the military.
Yeah, I was struck by how the booklet defined PTSD right off the bat. It's more than just feeling shaken up after something scary, right? It's a full-blown mental health condition.
Yeah. It is, and it's triggered by living through or witnessing something truly life-threatening. Think about it this way. Our brains are wired for survival. When we face danger, our bodies go into fight or flight mode. But when that danger is extreme or prolonged, it can leave a lasting mark on our nervous system. PTSD is essentially what happens when those survival mechanisms get stuck in overdrive, even when the danger has passed.
So it's not a sign of weakness, as some might think. The booklet actually says, if thoughts and feelings from a life-threatening event are upsetting you or causing problems in your life, you may have PTSD. That really highlights the day-to-day struggle.
Exactly. It emphasizes how PTSD isn't just about the event itself, but about the ripple effects it has on your life, your relationships, your ability to function. But there's good news here too. Effective treatment exists and can dramatically improve someone's quality of life.
That's where we need to head next for sure. But I think before we get to treatment, there's a statistic from the booklet that really stopped me in my tracks. It said at least half of all Americans will experience a traumatic event in their lifetime. Half. That's a huge number.
It is a staggering number, and it underscores why understanding PTSD is so important. Now, while not everyone who goes through trauma develops PTSD, thankfully, a significant percentage do. About 1 in 10 men and 2 in 10 women develop PTSD after a traumatic event, and the fact that women are twice as likely as men to develop PTSD is something researchers are still trying to fully understand.
It's a reminder that trauma can affect anyone, regardless of background, strength, resilience, all those things we might assume make someone immune. The booklet shares the story of Major Joshua Brandon, who received a Silver Star for bravery in combat, but still experienced PTSD.
His story, and the stories of so many others like him, dismantle the myth of the unbreakable soldier or individual. Trauma doesn't discriminate. It doesn't care how brave or accomplished you are.
And it's important to remember that trauma isn't limited to combat or those obvious situations like assault either.
That's right. Even witnessing a horrific event or dealing with the aftermath, like being a first responder, can be profoundly traumatic. Think about the cumulative exposure those folks experience. It takes a toll.
The booklet gives the example of Stacy Pearsall, an Air Force veteran, who talked about her struggles with sleep years after her service, all because of lingering adrenaline and anxiety.
It's a perfect illustration of how the effects of PTSD aren't always immediate or obvious. It might not be a flashback or a panic attack. It can be a constant undercurrent of tension, impacting sleep, relationships, your ability to relax and feel safe. It can be insidious, impacting your life in ways you don't even realize are connected to the trauma.
So how do you know if what you're experiencing is actually PTSD? The booklet breaks down the symptoms into 4 core categories, what they call clusters.
Yes. These clusters provide a really helpful framework for understanding how PTSD manifests. It's not just one thing, but a constellation of interconnected symptoms, and everyone experiences them differently. Let's start with the first cluster, reliving the event. This can involve intrusive memories, nightmares, or flashbacks.
You know, when you hear the word flashback, it's easy to picture someone being completely transported back to the traumatic event, like they're actually there again. But the booklet makes it clear that flashbacks can take many forms, right?
Absolutely. Sometimes it's a vivid sensory experience, but it can also be a sudden, overwhelming wave of emotion that seemingly comes out of nowhere, triggered by something as simple as a smell, a sound, or even a specific time of day. The booklet uses the example of a car backfiring, triggering intense memories of gunfire for a combat veteran. But for someone else, it might be a certain song on the radio that sends them spiraling.
It really shows how unpredictable those triggers can be. And it also highlights the importance of understanding those triggers and developing coping mechanisms to manage them.
Exactly, because the next cluster, avoidance, is all about trying to manage those triggers, but often in ways that end up being counterproductive.
It makes sense though, right? If something brings up those terrifying memories and feelings, your natural instinct is to avoid it.
Of course, it's a survival mechanism. But the problem is that avoidance can start to take over your life. You might avoid certain places, people, activities, even thoughts and feelings. It becomes a shrinking world, and it prevents you from engaging in life fully.
And it's not just about avoiding external things, right? The booklet talks about how people with PTSD might also avoid internal experiences, like numbing their emotions.
That's the third cluster. Negative thoughts and feelings. It's a shift towards negativity that can impact everything, from your self-perception to your worldview.
The booklet quotes Sarah C. Humphreys, an Army veteran, who talked about how this emotional numbness can be particularly damaging to relationships. You're essentially shutting down to protect yourself, but it can push people away.
It's a heartbreaking paradox. You're trying to cope with overwhelming pain, but in doing so, you might be unintentionally creating more distance and isolation.
And then there's that fourth cluster, the one they call feeling on edge or hyperarousal.
This is where we see those classic fight or flight symptoms persisting long after the danger has passed. Difficulty sleeping, being easily startled, constantly scanning your environment for threats, irritability, angry outbursts. These are all signs that your nervous system is stuck in overdrive.
It's like you're always bracing for impact, even when there's nothing there. It must be exhausting.
It is. It takes a tremendous toll, both physically and emotionally. You're constantly on high alert, unable to fully relax or feel safe.
Okay, so we've got a clearer picture now of what PTSD is and how it can manifest. But I think it's really important to reiterate that it's not a sign of weakness. It's a medical condition, just like any other.
Absolutely, and one that's often misunderstood. The stigma surrounding PTSD can prevent people from seeking help, which is tragic because effective treatment exists. The booklet does a great job of debunking some of the myths surrounding PTSD and encouraging people to reach out for support.
That message of hope is so crucial. So let's talk about treatment. The booklet emphasizes that PTSD is treatable, even if the trauma happened years ago.
Yes, and that's a powerful message. It's never too late to seek help and find healing. The booklet highlights two main approaches to treatment: trauma-focused psychotherapies and medication.
Okay, so let's break those down. When I hear trauma-focused psychotherapy, I immediately think about having to relive those traumatic experiences in therapy. Is that what it's all about?
Well, it can involve revisiting the trauma, but it's not about simply rehashing the experience over and over again. It's about processing it in a safe and controlled environment. With the guidance of a trained therapist, the booklet discusses three main types of trauma-focused therapies: prolonged exposure, cognitive processing therapy, and EMDR.
Let's start with prolonged exposure. That sounds intense. What's the thinking behind that approach?
It's based on the idea that avoidance, while understandable, ultimately keeps you stuck. In prolonged exposure, or PE, you gradually and systematically confront the things you've been avoiding: thoughts, feelings, situations, places, with the support of your therapist.
So it's about facing those fears head-on rather than running from them.
Exactly. It's a challenging process, but it can be incredibly effective. Through repeated exposure, you essentially retrain your brain to recognize that those triggers, while distressing, are not actually dangerous. You start to reclaim your life one step at a time.
That makes sense. And what about cognitive processing therapy? How does that approach differ from PV?
CPT, or cognitive processing therapy, focuses more on changing your thoughts and beliefs about the trauma. It's based on the idea that after a traumatic experience, it's common to develop negative or distorted thoughts about yourself, the world, or even the meaning of life. These thoughts can fuel feelings of guilt, shame, anger, or fear, making it difficult to move forward.
I can see how getting trapped in those negative thought patterns could really prolong the suffering.
Exactly. So in CPT, you work with your therapist to identify those unhelpful thoughts and challenge their validity. You start to develop a more balanced and realistic perspective on the trauma and its impact on your life.
So it's about reframing the narrative, so to speak.
Precisely. It's about taking back control of your thoughts and beliefs rather than letting them control you.
And then there's EMDR, right? Eye movement desensitization and reprocessing. I've heard about it, but I'm still not quite sure how it works. It sounds a bit mysterious.
It does sound a little unconventional, but it's gained a lot of traction in recent years. With EMDR, you focus on specific eye movements, sounds, or taps, while simultaneously recalling the traumatic memory.
I'm picturing someone waving their fingers in front of your eyes while you talk about your trauma.
It's not quite like that. The specifics of how it works are still being studied, But the general idea is that these bilateral stimulations, the eye movements, sounds, or taps, somehow help the brain process the traumatic memory in a more adaptive way. It's like helping the brain unstick from those painful experiences.
So the idea is that these external stimuli somehow facilitate internal processing.
Exactly. And while it might sound a little strange, there's growing evidence that EMDR can be highly effective in reducing the emotional intensity of traumatic memories and helping people feel less overwhelmed by them.
That's fascinating. So we've got these various trauma-focused therapies, each with its own unique approach. What about medication? Is that an option for PTSD?
It is. Medication can be a valuable tool, often used in conjunction with therapy. The booklet mentions SSRIs and SNRIs as common medications prescribed for PTSD.
Now, I know those are types of antidepressants, but could you give a quick explanation of how they work, especially in the context of PTSD?
Of course. SSRIs and SNRIs work by regulating the levels of certain neurotransmitters in the brain, specifically serotonin and norepinephrine. These neurotransmitters play a key role in mood, anxiety, sleep, and other functions that are often disrupted in PTSD.
So it's not about erasing the memories of the trauma, but rather about managing the symptoms, like anxiety, depression, or insomnia, that make it so hard to function.
Exactly. It's about providing relief and creating a more stable foundation for engaging in therapy and other healing practices. And it's important to note that medication should always be prescribed and monitored by a qualified healthcare professional.
Of course. Now, I imagine for some people, the thought of starting any kind of treatment for PTSD can be daunting. Are there any common concerns or misconceptions that the booklet addresses?
There are several. One big one is the feeling of not being ready for treatment. It's normal to feel hesitant, to come up with reasons why now isn't the right time.
It's a big step.
Hmm?
And it can be scary to think about opening up those old wounds.
Absolutely. But the booklet points out that this avoidance, this not feeling ready, can actually be a symptom of PTSD itself. It's part of the cycle that keeps you stuck.
So how do you break through that?
The booklet includes a great analogy from Dr. Ron Ashierno, a clinical psychologist. He says getting ready for treatment is like asking yourself, how do I know I'm ready to get in better shape? How do I know I'm ready to be a better parent? How do I know I'm ready to be a better person? If you're feeling pain, you're ready for treatment. It's about taking that first step, even if it feels terrifying.
I love that analogy. It really reframes the whole idea of readiness.
Another common concern is finding the right therapist, someone who truly understands what you've been through.
I imagine that's a huge factor. It would be hard to open up to someone if you didn't feel like they got it.
Absolutely. And while a therapist's personal experience with trauma can be helpful, the booklet emphasizes that it's not the most important thing. What matters most is that they understand how you think about your experience and that they can teach you the skills you need to manage your symptoms.
So it's about finding someone you trust, someone who feels safe and supportive.
Exactly. Building that therapeutic relationship is crucial to successful treatment.
Now, before we move on, I want to make sure we provide our listener with some practical resources, places where they can find more information and support. What does the booklet recommend?
The booklet highlights several excellent resources. One of the best is the National Center for PTSD website. It's a treasure trove of information on everything from understanding PTSD to finding treatment options. The website address is www.ptsd.va.gov.
That's easy to remember. And I imagine for people specifically looking for local treatment, the booklet mentions a directory too.
They do. The VA's PTSD program directory is a great place to start. It can help you find treatment providers and programs in your area.
What about people who are still trying to figure out which treatment approach might be right for them? The sheer number of options can feel overwhelming, to be honest.
I agree. And the booklet anticipated that. They recommend checking out the online PTSD treatment decision aid. It walks you through the different types of therapy and medication, helps you weigh the pros and cons, and guides you toward making an informed choice that aligns with your needs and preferences.
That sounds incredibly helpful. And it's all available on the National Center for PTSD website.
It is. They've really done a fantastic job of creating a comprehensive resource hub for anyone touched by PTSD.
Okay, so we've covered a lot of ground in this deep dive into PTSD.
Yeah.
For me, it's been both eye-opening and reassuring. We've explored the complexities of the condition, but also the very real possibilities for healing and recovery.
It's like we've peeled back the layers of stigma and misunderstanding to reveal the core truth. PTSD is a real medical condition. It's not a sign of weakness and it's treatable. Treatment can make a profound difference, not just for the individual, but for their families and communities as well.
It makes you think about how we as a society talk about trauma and mental health. I mean, we've gone deep on the symptoms and treatment. But I wonder, what can we all do to create a more supportive and understanding environment for people who have experienced trauma?
Hmm.
Even if we haven't personally gone through it, how can we show up for those who have?
That's a fantastic question, and one I think about a lot. For me, it starts with fostering a culture of empathy and understanding. It's about recognizing that trauma is pervasive,
Yeah.
that it touches countless lives in ways we might not even realize.
It's about looking beyond the surface and remembering that everyone is carrying something, even if we can't see it.
Exactly. One small but significant step is simply being mindful of the language we use, avoiding phrases that minimize or trivialize trauma, like just get over it or it's all in your head.
Those phrases can be so incredibly dismissive,
Yeah,
and they often come from a place of not understanding the complexities of trauma and how it affects the brain.
absolutely. It's also essential to listen without judgment. When someone opens up about their experiences, resist the urge to offer unsolicited advice or comparisons. Sometimes the most powerful thing you can do is simply listen with a compassionate ear, validate their feelings, and let them know you're there for them without trying to fix them.
Just being present and creating a safe space for them to share. I love that. It seems so simple, but it can be so profound.
It can. Another way to contribute is by educating ourselves about trauma and its effects. The more we understand PTSD, the better equipped we are to support those who are struggling.
So true. Knowledge is power, as they say. It can dismantle stigma and create more open dialogues. If someone you know is struggling, what's one small compassionate step you could take to offer support?
I think just starting by simply asking how they're doing and genuinely listening to their response. Let them know you care, that you're there for them, and that you support their journey toward healing. Encourage them to seek professional help if they haven't already, and offer to help them find resources. Remember, even small gestures of kindness can have a huge impact.
What a beautiful thought to end on. Thank you so much for sharing your expertise with us today. This has been a truly insightful deep dive into PTSD.
It's been my pleasure. And to our listener, remember you're not alone. There is help available, and recovery is possible.
That's all for today's deep dive. Until next time, keep learning, keep exploring, and keep the conversation going.